Hello friends and welcome back to my channel. In this video we are going to talk about rubella, congenital rubella syndrome, biological death and clinical death, paratonsillar abscess, retinal vessel occlusion and immunoglobulins, and we are going to see the questions over these topics. So let's start. So first is rubella. So rubella is also known as German measles. It's a viral infection caused by the rubella virus. And I wrote something in the corner. Catharal is an inflammation of the mucous membrane which will lead to the higher mucus secretion. So let's see what are the symptoms. As you can see here, the highlighted part, the rash in rubella will be on the extremities. So first the rash starts on the face and then go downward toward the trunk. So rubella is an infection. You will see fever in the patient, lymphadenopathy, conjunctivitis and respiratory symptoms. A lot of things will be there. You will understand better with the question explanation. So let's start. First patient says about he has been ill for the 3 days and today he has a low grade fever, catharal symptoms, non-abundant maculopapular rash on her buttocks and enlarged occipital glands. Remember about it guys, that when the occipital lymph nodes are enlarged, so this is something typical finding for the rubella virus. So let's see the next patient. Next patient also complained about the enlarged occipital and axillary lymph nodes. As you can see here, that lymphadenopathy, it will start at the back of the neck, especially behind ears and the back. This is something finding which is typical for the rubella virus. So you understand the complaints of the second patient as well. Next is the examiner is asking about which vaccine you are going to provide to the school children who are suffering from measles. So you know about this, that MMR vaccine should be provided. MMR vaccine contains measles, mumps and rubella, three of them together, so better treatment or better prevention. Next is the congenital rubella syndrome. So you have to remember this, that the baby with the congenital rubella syndrome will be having deafness, cataract, heart defects, intellectual disabilities, growth retardation, all of these things. What is congenital rubella syndrome? If a pregnant woman if the pregnant woman had rubella, particularly in the first trimester, so virus can cause the serious birth defects in the fetus. So a petechial rash we are going to see. There is something written in the corner. Rubella infection during the pregnancy, first trimester, terminate the pregnancy because there is high risk for the congenital rubella syndrome. And a lot of birth defects are there. So what we will do with the newborn with deafness, cataract, heart defects, so a lot of complications are there. It's better to terminate the pregnancy and plan for the next pregnancy. So let's go next. Next is about the next patient says that a new boy of 38 week of gestation, weight is this, present with ventricular septal defect, cataract in both eyes, deafness. So you know about it, that this is the case of congenital rubella syndrome, as we just saw the symptom. Yeah, so let's go to the next patient. Next patient says what? Next patient is saying about the newborn developed rash on the body and physical examination, Apgar score 7 and 9, physical examination temperatures, pulse is high, respiration is high, petechial rash on the torso. So you remember from the definition portion that which type of rash we will see in the children. We are going to see the petechial rash in the children, particularly on the torso of the patient. Systolic diastolic murmur, this is highlighting what? This is highlighting the birth defects, the heart defect probably. So guys, this is the case of congenital rubella syndrome as well. So let's see the question 6. The 25-year-old woman hospitalized 11 week of pregnancy, so she is diagnosed with the rubella. So we know now that if you are getting rubella until the 12th trimester, it's better to terminate the pregnancy since there is a high risk for the congenital rubella syndrome. Next, let's go to the biological and clinical death. So first is clinical death. So clinical death is a stage where which is immediately following the cessation of the heart activity and breathing, but before irreversible damage to the other organs, for example brain, occurs if the resuscitation measures are provided correctly or the emergency care is provided correctly to the patient. So clinical death is a reversible process and it can be cured, or if the emergency procedures are done, then the patient may get back to the consciousness. So heartbeat to the cardiac arrest, respiratory arrest, loss of consciousness, pupil become flexed and dilated. This is something we are going to use in our croc questions, that if the pupil become fixed and dilated, this is the case of the clinical death. Next is biological death. Biological death is the irreversible death. So it occurs when the brain cells and the other tissue die due to the prolonged oxygen deprivation. So, and the resuscitation is not possible in this case. So once the biological death happened, then the patient will not wake up again, because there is a permanent loss of brain function, so called brain death, and there is cellular death, necrosis, heart and breathing stops permanently. So the patient cannot be resuscitated anymore. The organ failure starts to happen. The brain cells will start to die within minutes, some 4 to 5 minutes. If the oxygen is not supplied to the brain cells, some 4 or 5 minutes the brain will start to die. Let's hear our patients. Patient suddenly felt acute the chest pain radiating to the left arm, excited with the pale skin, and breathing is very high. Arterial pressure is severe. Later, the patient lost his consciousness, fell down, and the pupils are dilated. So, pupils are dilated, which is this case. The clinical death is there. So if the resuscitation can be provided to the patient right now, the patient may get back to the consciousness. And the second patient also complains about the dilated pupil. We see the dilated pupil in second patient as well. So this is the case of clinical death as well. Next is the pupils are dilated again. Let's go next. Next is this is something important which you have to remember about it. Let's hear it from patient, that examination of the corpse of man who died by hanging reveals that the spots of liver mortis disappear when pressed and reappear within the 50 seconds. And the rigor mortis is moderate, the observed only in the masticatory muscles of neck. So remember from the body temperature, guys, that body temperature approximately decreases 1 degree per hour. If you cannot understand other things in the question, so here is something highlighting thing for you, that if the body temperature after the patient has died reduces 1 degree per hour. So in this case, the patient the normal body temperature if in the ranges of between 36 to 37, so we know that if the patient is having 31 degrees Celsius, so he died before some 6 to 7 hours ago. Hope this is clear now. And next patient also says about the pupils are dilated. You can read the whole profile of the question and it will be easy to remember now. So this is the case of clinical death. Next is paratonsillar abscess, also known as quinsy. So this is, let's define it, a collection of pus near the tonsils, complication of the untreated severe tonsillitis. So symptoms which we are going to see, is sore throat, painful swallowing due to sore throat, difficulty in breathing, fever and chills, difficulty in opening mouth because the pus is there in his tonsil area, a hot potato voice they say, which is not used in question I guess. Ear pain on affected side, swollen lymph nodes of the neck. These are the things. Let's hear them from the patient so that we remember it. So let's see. This is a 3-year-old girl having fevers. Nose and mouth breathing is difficult for her. Hyperthermia, enlargement of the tonsil, and hyperemia, bulging of the posterior oropharyngeal wall. So why the bulging is there in the posterior oropharyngeal wall? So because there is a abscess is over there, so the posterior pharyngeal wall will look a little bit bulged up. So what complication occurred in the patient? The complication is retropharyngeal abscess. Next patient also complains about the same thing. 36-year-old having headache, obstructed nasal breathing, purulent discharges from the nose, 2 weeks. A month before, he had his right maxillary premolar filled. So patient had some problem with the teeth, so he decided to get his teeth filled. So now on the radiography, what they find is intense opacity on the right maxillary sinus. So diagnostic puncture revealed a large amount of thick, foul smelling crumbly pus. So the options were given like similar in the question. So let's decide it. So it is from 2 weeks, so it is already chronic in this case. However, we know that the classification for abscess is different for acute and chronic, but for this case you will have to remember that within 2 weeks itself the paratonsillar abscess starts to get this chronic cases. As they talk about the maxillary, so this is inflammation of sinusitis. The patient is complaining about thick, foul smelling discharges, which is pus. So this is suppurative here, and this is due to the right maxillary premolar field. So this is known as odontogenic. And so the final answer states chronic suppurative odontogenic sinusitis. The question is tricky, guys. I hope you will remember it. Next is the similar cases over there. The patient had an extraction of the second molar tooth. So the patient got diagnosed with the paratonsillar abscess later. So what was the route of infection? The route of infection was through the teeth. The teeth got his the extraction of teeth led to this all complication. Yeah. So the route of infection is odontogenic, the teeth bone infection. Okay, next is retinal vessel occlusion. So retinal vessel occlusion is simply the blockage of blood vessels that supply the retina. Therefore, sudden painless vision loss we will see in the patient. The symptoms we are going to see sudden painless vision loss because one of the vessel got occluded. Blurry vision because no more supply will be there. Partial or complete vision, dark spots or shadows in the vision. Let's hear it from the patient. The patient says 58-year-old man developed multiple spots in his vision, after which the vision in his right eye got darkened and pupils are dilated. Its direct response to the right is reduced. Ophthalmological finding says that multiple hemorrhages of varying size and shape of fundus of the eye. Squamatosign is something the Croc question highlights very well. The optic disc is edematous and hyperemic. So why it is hyperemic? Because this is the case of thrombosis of the central retinal vein. So since the patient has some thrombosis in the retinal vein, so the patient got problem with his vision, and the visual capacity of the is 0.02 given here, which is not even close to normal. Normal should be 1. And we see the multiple hemorrhages. So this is the case of thrombosis of the central retinal vein. Next is immunoglobulins. Immunoglobulins, what are they? They are antibodies, sir. So proteins produced by plasma cells, a type of WBC in response to the antigens such as bacteria, virus, foreign substances. So let's hear it that they are of 5 types. So G, A, M, E, D. Yeah. So we will try to remember them, however in only one question in the Croc exam, but good to remember them. So IgG are for the long term protecting after the vaccination. IgA antibodies are found in the mucous membrane, for example the breast milk. And IgG are most common type of antibodies which will be found in the blood circulation. IgA will be found in the saliva, tears, like the mucous membranal system, like the breast milk. And next, IgM antibodies indicates the recent infection. That if you see the IgM antibodies are there given in the question, this is the some indicating some recent infection, that just now or recent infection is there. So Ig indicates the allergy and IgD indicates the immune responses by activation of the B cells. Let's see the patient. The patient is having this and these complaints. You can read the whole question, but I got pollen grains here. So pollen grains are related to the allergic case, and bronchial asthma attack. The patient is also related having anamnesis of bronchial asthma attacks, so which is induced by the pollen grains. So this is the case of allergic case. Allergy means IgE antibodies. So allergy, the word E highlights the IgE. So remember about it. This is it with this video. I hope you enjoyed the video. See you in the next one.